Well, welcome to this UK drug testing and ValueMed joint product demonstration. This is the new ALLTEST Saliva Ketamine specific saliva test. So it screens just for ketamine at 50 nanograms and it's designed for quick and rapid screening. What you get in the box is foil wrapped cassettes, and this is one of those cassettes. You'll see it has S for the sample well, a T line marked and a control line marked in this window. And then for collecting your saliva, you'll get a cellophane wrapped swab on a stick. This is what is used to collect saliva from the oral cavity. And this little device is a collection bulb, and a little flip device in the top turns it into a pipette to allow you to dispense your collected sample into the sample well. So to run a ketamine screen, you need to keep these foil wrapped until you're just about ready to test. Ensure that the donor you're about to screen hasn't had anything to eat or drink for ideally 20 minutes, minimum 10 minutes, and that they haven't smoked ideally for the 20 minutes before you're sampling. And then when you're ready to test, remove your cassette from the pouch and give the sample collector swab to the person to place into the mouth and collect that saliva. Before you do so, you should ask them to, with the tongue, move the tongue along the front and bottom of both sets of teeth and the back of both upper and lower teeth. Lick the gums and then lick in a forward motion the base of the mouth, and this will produce a lovely pool of saliva into which you can ask them to place this saliva swab. And then you should collect the saliva from around the oral cavity for around 2 to 2.5 minutes. So what I'm going to do now is collect a sample on myself and then show you how this is transferred into the collection bulb and the test is run. Okay, now when the swab comes out of the packet, it's firm and rigid, but by the time it's saturated in saliva, it should be soft and squishy like this. Remove the cap from the collection device and, holding it upright, push the swab firmly down into the base and repeat, push it down. And it should have collected in excess of 5 mils of oral fluid by the time you've finished squeezing it out. There is a little indicator marker on the side of here, which is what you're aiming for. And when you've filled the bulb with all the saliva from the swab, tightly screw up the lid. Okay, now there are no chemicals. This is a completely inert sponge on a stick, so if you haven't successfully managed to swab enough saliva, then this can go back into the oral cavity of the donor and ask them to try harder until you've got a good sample, and this is a perfectly adequate sample to run a single test. And when you're ready to do so, flip the little bulb pipette at the end, holding it over the sample well, invert the device and gently squeeze the bulb between your fingers, and you'll see 1, 2, 3 drops are probably all you're going to need to run this test cassette. You can then close the little pipette device and you see how little of that sample I've actually required. Now you start a timer now, and you're looking to read this test at 5 minutes. So if I start a timer on my watch, you'll see that the test is flowing laterally. This is why we call them lateral flow devices. You'll see I've already got a test line forming here, but I can't interpret that as a negative result just yet. I've got to wait until the control line runs, and you should do this on a flat, even surface like we are doing here. So I'm going to stop the video now, and we will pause it and restart when my 5-minute timer goes off. Welcome back. 5 minutes have elapsed, and you can see a beautiful white background with a very clear control line and a test line indicating this has not detected ketamine at the 50 nanogram cutoff sensitivity that's designed to do so. If you do not have that test line showing but a clear control line, you must wait a full 10 minutes for a test line to develop, and any test line showing in the presence of a control line should be interpreted as a negative result, even if it is thin, faint or partial. So they will give you negative results very early, as we demonstrated here, but you must have the control and test line showing before you interpret it as negative. There is no need to wait if you have both showing for the full 10 minutes read time, as the test line will not disappear or vanish during the course of the lateral flow process. So once it's formed, it's there, but you must always have the control line showing. Those are the ketamine single saliva tests demonstrated for you. Extremely accurate, very reliable, and ketamine is becoming an increasing regular issue for parents and employers in terms of its regular use with cannabis and cocaine in the club scene in the United Kingdom. So we now have these specific single tests for targeted testing. They're available from the UK Drug Testing, ValueMed and DTK websites, and we'll put a link in the description below that you can click on, taking you directly to our website offer a sale for these test kits. Thanks for watching.